Good morning, everybody. Our topic today is issues of aging, making your own decisions, your health. Today, we're going to talk about your hearing and eyesight on today's edition of Senior Moments. Our guests today are Drs. Craig J. Helm and Dr. Patrice Rifkind. Dr. Helm obtained his Bachelor of Science degree in biochemistry from UCLA, where he was a varsity gymnast. Dr. Helm went on to pursue his medical education at Tulane University of Medicine and was an academic achiever selected into the Alpha Omega Alpha Medical Honor Society. Dr. Helm completed residency training in ophthalmology at the prestigious UCLA Jules Stein Eye Institute. He continued his fellowship training at UCLA in cornea and refractive surgery and uveitis. Dr. Helm served in the United States Air Force at the Portsmouth Naval Medical Center for 3 years. He's co-authored numerous scientific papers and book chapters. Dr. Helm moved to Santa Clarita in 2001 to establish his premier practice, excelling in delivering university-level care in a new state-of-the-art setting. His practice focus remains cataract surgery, corneal transplantation, and laser vision correction. Dr. Helm lives in Santa Clarita with his wife and children. His outside interests include woodworking, guitar, piano, singing, and staying in shape. Dr. Rifkind is the owner of Audiology Associates, which is a private practice serving the needs of people with hearing issues since 2001. Dr. Rifkind earned her master's degree from Cal State Northridge in 1995 and her doctorate from the University of Florida in 2004. Dr. Rifkind is licensed by the state of California for audiology and hearing aid dispensing. Dr. Rifkind is a member of the SCV Senior Resource Alliance, Santa Club, and the Assistance League of Santa Clarita, which are all local organizations. She was also awarded the Santa Clarita Valley Leadership Award for 2012 Minority Women-Owned Business of the Year and was voted the best audiology office in the SCV for the last 7 years by the Signal and the Daily News Readers. Dr. Rifkind has lived in Santa Clarita with her family for over 20 years. Welcome, doctors, to Senior Moments.
Thank you, Joel.
Thank you. Good morning.
Good morning. And who would be the kinds of patients, who would be the patients that you see most often, most frequently? We can start, Dr. Helm.
Personally, I see patients who are either referred for cataract evaluation, who have been diagnosed elsewhere with cataracts, glaucoma evaluations, macular degeneration, eye pain, dry eyes are very common, especially here in this valley, in this climate, and not only causes a lot of debility in terms of symptoms, but it affects vision as well.
When you say macular degeneration, that's characteristically a disease of the elderly.
Well, I wouldn't say over 50 is elderly, Joel.
I wouldn't either.
But typically it's a disease that affects people over 50.
Okay. And Dr. Rifkind, how about you? What do you see most frequently?
I would say we see seniors most frequently. We do see lots of people below the age of being senior at 30s, 40s, 50s, and children too. So I would say the highest percentage are people that have hearing issues, people that have ringing in their ears.
Is it common for people to visit your practices that don't have a problem or an issue? Do people just come in for a check?
Not as often. I mean, we do get people who will say, I really want to make sure my hearing's okay because I know that I have a family member that, I might have a family history of hearing problems, or I was exposed to a lot of noise. How's my hearing? And they might be okay. But, yeah, so they should.
And yeah. Obviously they could get some kind of a hearing test, some kind of an evaluation.
Mm-hmm. Exactly. Yeah. And it doesn't take long, and then they find out they can have the peace of mind in knowing that their hearing is fine.
Dr. Hill?
We see a lot of people who don't specifically have complaints, beginning with children whom parents bring in before they start school, at the time they start school, to make sure that they're able to see the board, able to read appropriately and normally. And anybody who wears glasses or contact lenses certainly come in to be evaluated. We have 3 ophthalmologists and 1 optometrist in our practice here in town. So we see people with no complaints just wear glasses and contacts.
And is that common, though? Is that common when people just come in just for a regular exam?
It is, as Dr. Rifkind was saying, people have family histories of particular diseases like glaucoma, which does run in families, and people want to know, do I have signs of glaucoma, or do I have signs of macular degeneration? And they come in for an evaluation to either be told they have some signs or to have some reassurance that they don't.
Dr. Rifkind?
Yeah, we do run into the same type of thing. We have people that have had noise exposure often have hearing loss, not always.
Now, noise exposure, what is that?
Noise exposure, they worked in noisy environments, maybe a factory, maybe I met a granite cutter yesterday with pretty bad hearing. So, but then I will have some people who will come in and they'll say I was a policeman or a fireman, and I rode motorcycles and sometimes race cars on the weekends, and I even went shooting guns a little bit, and they'll have normal hearing. So we never really know until you get in there in the sound booth with the headphones on and find out.
Similar with you, Doctor. With vision?
With vision, absolutely. People come in and have a family history. Typically, people don't come in for environmental exposure, but that certainly is a problem. We see surfers who get particular conditions that are related to sun exposure, growths over the surface of the eye, even cataracts.
That happens to ears, too. They get little bumps in their ear canals
right.
sometimes.
Mm-hmm.
Boy, we're getting similarities, aren't we?
Yeah.
Quite interesting. With recently, a friend of mine developed cancer, not what we were speaking of previous. And what happened was that he went for a vision test, wore glasses, but had pretty good vision. And they found eye cancer. And it turns out that we came to learn that eye cancer was a precursor of liver cancer.
There are different types of cancer of the eye. The most serious is called a choroidal melanoma.
I think that's what he had.
And that is associated with a 50% mortality rate.
And he was unfortunately part of that group.
And the reason is it typically gets diagnosed late.
Exactly right.
Because it can't be seen by the patient. And so they're only detected when they come in for an examination. And fortunately, I've only had a couple people in my career in the last 25 years who've had a choroidal melanoma. But when we see it, it's typically large because they haven't come in with any symptoms.
And it was because, in his case, was because of blurry vision.
Right.
Oh, right.
And are there similar risks? Are there similar precursors in hearing where a hearing loss could be the precursor to something a great deal more serious?
Well, yes. We get acoustic neuromas.
What is that?
Which it's a tumor that grows on the nerve. It's a benign tumor, but it's inside your head on the auditory nerve. So a person may complain of ringing in one ear, and maybe that's the only symptom for a while. Maybe they're not hearing quite so well, maybe on one ear. Then we find a little, more time goes by, all of a sudden the person's dizzy a little bit. And if we don't catch it earlier, then, you get more and more symptoms. But, so that, that's pretty serious.
Yeah, that's very serious.
Mm-hmm.
Let's lighten up a little bit.
Good idea.
Yeah, I think we should. For most people, how often should they have both adults and the parents of adults? How often should they have an eye check and a hearing check?
With respect to eyes, it depends upon whether or not they have certain conditions. Diabetics, of course, need to be seen annually.
Why?
Because of the risk of diabetic retinopathy. Diabetic retinopathy is a disease that affects the retina. It affects the small blood vessels throughout the body, but particularly the retina can be affected, and it can cause bleeding inside the eye. It can cause detachments of the retina, very serious conditions that, if they're caught early, can be treated and vision can be preserved.
How about hearing?
Once again, it depends on what kind of conditions they have. So yes, diabetes would be something that would be a reason to have your hearing tested more often. Family history, problems with hearing to start with. I would recommend most people get a hearing test once a year if they have any problems. If they don't have any problems, when we test them, we'll say, you know what, unless things change, go ahead and come back in 5 years. Depending,
Sure.
Especially for the younger people.
Sure. The people that we deal with at Home Instead Senior Care are adult children and the parents of adult children.
Mm.
And the common ailments of the parents of adult children, as you know, tend to be things like high blood pressure, diabetes, very frequently heart or brain-related issues, dementia. Is dementia a reason to see both of you more often?
Yes, because dementia is complicated by loss of communication. So if anybody has even a mild hearing loss, they're twice as likely to have dementia. And just recently, just this week, they came out with a study about hearing aids. It's a long-term study in Europe, and basically
long-term meaning how long, roughly?
A 25-year study.
Okay, way long.
So they compared people that had hearing loss, people that wore hearing aids, people who didn't wear hearing aids in the same condition, and the people that had hearing aids were equal in mental decline to the people that had normal hearing.
Wow.
Versus the people that had hearing aids did not have hearing aids, but had hearing loss, became worse at a much faster rate. So that's an important reason right there.
And how about with sight, Dr. Helm?
Oh, I agree. With dementia, it exacerbates the condition if they're losing their senses. So I agree with loss of hearing, loss of sight. It just worsens an already difficult situation. So we do cataract surgery on patients with dementia when they are significant and affecting their vision, because it will enhance their ability to function if they can see their surroundings better.
Right, and
Yes.
Obviously with both issues, both health issues, this becomes much more of a danger to them and their families as well, I would imagine, too.
Yes, I agree.
Mm-hmm.
What other things become more prevalent, especially as we age, that you see in the world of sight and hearing? What other kind of health issues do you see a great deal more incidence of?
Well, we tend to see more psychological conditions.
Like what?
Anxiety, depression, paranoia. Maybe those people are talking about me. I saw them laughing and I didn't understand what they said. The absolute increase in stress involved in trying to follow a conversation if you're hearing half of it.
And I would guess that would be, again, we're not only talking about the person that feels that, we're also talking about family members.
Mm-hmm. Oh, yeah. So the relationship of the family is there. I've seen sometimes a wife with a husband who has a hearing loss. The wife is putting up with the TV being much louder, and then mother moves in with them, and mother also has a hearing loss. And meanwhile, this one woman that has normal hearing is going crazy. I mean, and having to repeat herself all the time and very frustrated.
We at home instead, quite a while ago, we had a very elderly couple, and he could see but had no hearing. She had incredible hearing, but had very severe cataract and macular degeneration. They would drive together.
Perfect match.
Exactly.
We have to utilize each other's strengths.
Exactly right. And minimize our weaknesses.
That's right.
We, of course, asked, when and where do you usually drive, so that everybody on our staff could stay away from that area at that time of day. But, of course, they felt that they did not have a problem.
Well, the person who is deaf or even severely hearing impaired is allowed to drive because they shift.
Because that's not important.
Well, it is important to a certain extent, but the people that, for instance, bus drivers, they have to have good hearing, good hearing anyway. But, I mean, it doesn't have to be perfect, but they do have to pass the test to be that type of driver. But the person, just the casual driver, if there is a person who is deaf, they're able to visually orient themselves a lot differently than we do. So they will see the siren, the flashing lights before they hear anything, for instance.
And that's okay.
Yeah, and that is okay. No, I mean, there are many deaf people who drive. That's not...
And there are many blind people who drive. Sadly, you mentioned a bus driver.
You're scaring us.
That reminds me of a patient that I once saw who had 2200 vision in both eyes.
Wow.
And was actively driving a bus for the city. Not this city, but was actively driving a bus and was going to go back to work until I said, that's not a good idea. And that's a common issue with people who develop cataracts, is that typically that happens so slowly in terms of the loss of vision that people don't realize what they've lost. I'm sure the same thing happens with hearing.
It does.
But you gradually lose the details and you forget what's normal.
In different age groups, should different age groups visit your offices more frequently or less frequently as we age?
Oh, no question. When you get over 40, certainly that's a time for a baseline exam if you haven't been seen regularly because of other diseases like diabetes or hypertension. But at 40, we recommend a baseline exam. If everything's good, we recommend an examination every 2 years. If you have other factors, then perhaps sooner. But every couple of years, because diseases like glaucoma have no symptoms to it, you can walk along thinking everything's fine and not have anything affecting your vision until it does. And by the time you catch it, it's actually far gone and you can't restore what you've lost.
Wow, that's somber. Yeah. And how about with you, Dr. Ripka?
You're going to call for an appointment tomorrow, aren't you?
Probably am. I'll be visiting both of you.
I would say 40 is a good baseline level too.
I remember 40.
Yeah. If there are no other disease processes in 40 and they have very normal hearing, then probably 5 years at that point is fine.
So when I visit your offices and I fill out that initial questionnaire, for lack of a better term, I really have to put down all my medical conditions?
Yeah, because sometimes there are medical conditions that you don't know would affect hearing, for instance. Like kidney problems can affect hearing, and who would think, who not everyone would know that.
I never realized that. Oh my!
Same in terms of eyes. I agree, and also the medications that one is taking for any particular disease could have effects on the eyes.
Yeah.
So filling out the application and really being honest becomes kind of an important part of this process.
Yes.
It is. Complete information is essential.
Well, on that note, we're going to take a break. I'm Joel Green on your hometown station, KHTS AM 1220. The subject today on Senior Moments is issues in aging, making your own decisions, your health. Today we're talking about your hearing and eyesight. Our guests are Dr. Patrice Rifkind of Audiology Associates and Dr. Craig Helm of the Helm Vision Group. We'll be back right after this.